everyone. My name is Anaissa Leal,
And I'm Cody Kibbee.
and we are both PharmD candidates with the Texas A&M University College of Pharmacy in College Station, Texas. We both will be graduating in May of 2021 and are on track to become pharmacists.
So our presentation today is how do dopamine and dopamine agonists work in the treatment of Parkinson's? We're going to go over how does dopamine work in the body, dopamine agonists and decarboxylase inhibitors, they're a group of medications, how they work, and examples. And then dopamine agonists are another group of Parkinson's medications that have a different mechanism. And we're going to talk about how they work, and we're going to talk about examples of those.
What does dopamine do in the body? Dopamine actually controls a lot of different functions that make us who we are. So we have a happy face. We also have a sad face. So this shows that dopamine does control in various aspects, our behavior and our personality. It also is involved in how we formulate thoughts and how we think, and also, most importantly, how we control motor function, whereas walking and using various muscles in our body.
I'm going to go over where does Parkinson's occur and where do the medications work in the treatment of Parkinson's. Y'all may already be aware, but Parkinson's occurs in the substantia nigra, which is where our dopamine receptors are found. And the picture to the right shows a DAT scan. And in a patient that doesn't have Parkinson's, the dark region indicates that there's a high level of dopamine receptors. And then an individual with Parkinson's, you can see how there's not as much dark regions. That means there has been a loss of dopamine receptors.
What is the blood-brain barrier? It protects the brain from foreign substances. In other words, things that aren't meant to be there that might injure the brain. So that could be infections such as bacteria, viruses, things like that. The blood-brain barrier is meant to recognize that those substances do not belong near the brain. It protects the brain from hormones and neurotransmitters that belong in the rest of the body. It prevents them from entering, but it also protects the hormones and neurotransmitters that are meant to be in the brain. And lastly, it maintains a constant environment, which was what we need when we're dealing with medications, specifically medications dealing with Parkinson's, as it is involved with dopamine, which is a very important neurotransmitter in the brain. How do medicines get into the brain? We're going to be talking about two different groups of medications. On the left, we see dopamine agonists, and on the right, we have a different group of medications that are known as dopamine agonists with decarboxylase inhibitors. So to illustrate first how these medications get into the brain, with both of these medications, we see that they're able to coincide with the natural dopamine that is already present in the brain. So with dopamine agonists, its main function is to mimic dopamine. So the way that the blue circles represent the dopamine that's naturally in our brain, the other color is meant to illustrate that it's able to work alongside the natural dopamine, and it's able to have the function of dopamine that's already internally in the brain. On the next picture on the right, we're able to see the other group of medications, and this is able to illustrate that dopamine is able to go into the synapse, which is the top part in a U shape. That's the synapse, and it's able to have the dopamine agonist decarboxylase inhibitors. It's able to work alongside the other dopamine that's naturally present in the brain.
Now I'm going to go over what Parkinson's does to dopamine as time progresses. So as Parkinson's progresses, the number of dopamine cells are reduced and less dopamine is produced. So Levodopa and dopamine agonists replace the loss of dopamine. However, their effectiveness diminishes over time and tolerance can be built up with prolonged use of the medications.
Does dopamine affect our behavior? Yes, it does. So we're able to see on the right side a dopamine synapse with the natural occurring dopamine neurotransmitter in the brain. So we're able to see on the left side, there's an object called a dopamine transmitter, or a DAT. And this is meant to, it's a protein that's able to pump the dopamine out of the synapse, which you see the dopamine is actually going down to the receptors. And then further up in the middle, you see the VMAT2, which is a vascular monoamine transmitter. And this is meant to do the reverse of the DAT. It's able to get the dopamine to be surrounding in the synapse. And of course, you also see the presynaptic D2 receptor, which illustrates the receptors that are already on the bottom. So to go further into what exactly these receptors do, we illustrated what the functions are for D1 all the way to D5. D1 regulates growth and development and how we will mature as humans. And it also mediates some behavior responses. So how we conduct ourselves, how happy and sad we can become. And further on, we are able to see D2, which has a lot to deal with cognitive flexibility. So breaking that down, that means our levels of inhibition. How we plan our days is involved with cognitive flexibility, and also our working memory. For D3, this mainly encompasses our cognitive and emotional function. So again, relating to how our personality works and how it's broken down. D4, again, is working with the working memory, but also fear, our ability to understand fear on a neurological level. And then lastly, we see D5, which mainly deals with the learning and memory processes of our brain. However, all of these receptors, specifically D1 and D2, do deal with motor control and the way we move.
So now we're going to go over the first line medications and management of Parkinson's. And so the goal of these medications is to lessen the motor symptoms and control the on and off periods. And how these medications work is, or how any medication for Parkinson's would work, is it would work by replacing dopamine, copying dopamine, or enhancing the effectiveness of dopamine in the body. And so how does dopamine cross into the blood-brain barrier? So dopamine can actually not cross into the blood-brain barrier for two reasons. One, dopamine is hydrophilic, so therefore it doesn't mesh with the blood-brain barrier well and cannot cross it. It acts like a wall, the blood-brain barrier does to dopamine. And also it does not have a transporter that could carry it across the blood-brain barrier to get it inside the brain. What does get in the brain is levodopa. Levodopa can cross the blood-brain barrier through a special transport system called the L-type amino acid influx transporter 1. And the purpose of levodopa is it gets converted to dopamine, similar to like how a baby will eventually grow into an adult. That's kind of how levodopa works. It turns from levodopa into dopamine through a special chemical process. And so this graphic here shows the receptor LAT1 carrying across the little purple circles, which is levodopa. From outside of the brain, they get inside this transporter and get carried to the other side, similar to a car. And so what is a decarboxylase inhibitor? A decarboxylase inhibitor prevents dopamine from being broken down. So traditionally, levodopa gets converted to dopamine inside the body through a special enzyme known as the amino acid decarboxylase enzyme. And what that does, like I said, is it converts levodopa into dopamine. And so the purpose of the decarboxylase inhibitor is preventing the breakdown of levodopa to dopamine outside of the brain. So therefore, you don't have to use as much levodopa that will remain as levodopa and then get sent inside the brain, where then it will get converted into dopamine where it can be effective. Because it won't be effective if it's converted outside of the brain. So how do dopamine agonist and decarboxylase inhibitors enter the brain? Dopamine agonists work by increasing the overall levels of dopamine in the brain, and dopamine enters the brain as levodopa and then changes into dopamine by going through that chemical process mentioned earlier. So this red car is the protein that's the transport system, and the person inside the car is levodopa. And so the transport system carries the levodopa across that blood-brain barrier into the brain, where then inside of the brain, the levodopa gets converted to dopamine. Now I'm going to go over examples of dopamine agonist and decarboxylase inhibitors. The common medications include Sinemet, or carbidopa and levodopa. Rytary, which is carbidopa or extended release levodopa, Duopa, which is carbidopa slash levodopa. It's an enteral suspension, Embrysia, which is a levodopa inhalation. And the difference between these medications is their formulation. So whether they're inhaled or a tablet, or if they're extended release, and then how rapidly they are absorbed and have a therapeutic effect. Dopamine agonist and decarboxylase inhibitors, this group of medications we're still on this, is Cinemet. It's a carbidopa slash levodopa. It's metabolized in the kidneys. Its duration of action is 30 minutes to 1.5 hours before it's eliminated. The onset of action is 30 minutes, and it affects the dopamine 1 and dopamine 2 receptors, which are critical to control motor function. And so this image on the right just shows the chemical structures of levodopa and carbidopa. And then that image at the bottom there just shows levodopa binding to the dopamine 1 and dopamine 2 receptor once it gets inside the brain. And another dopamine agonist slash decarboxylase inhibitor is Rytary. Now this one is carbidopa and still levodopa, but it's extended release. And so it's still metabolized inside the kidneys. Its duration of action is significantly longer though. It's 4 to 5 hours. It is lipophilic, so that means it can cross the blood-brain barrier as levodopa. And it does affect the dopamine 1 and dopamine 2 receptors, which is important for motor function. It has the same chemical structure as Cinemet. It has levodopa and carbidopa, and it does bind to the same receptors. And another medication in this group is Duopa, which is the carbidopa slash levodopa enteral suspension, and it's metabolized in the kidneys. Its duration of action is 2 to 3 hours, but it is infused over 16 hours. So therefore it keeps the patient at a steady state, so they're not as likely to experience off periods. This one is lipophilic, so it can cross the blood-brain barrier, and it does affect dopamine 1 and dopamine 2 receptors. The last medication in this group of similar medications is Embrysia, which is a levodopa inhalation powder. This one is still metabolized in the kidneys, but its duration of action is 30 minutes before it's eliminated. And its onset of action is very rapid. It's 2 to 3 minutes. It's used for off periods or when the individual starts experiencing Parkinson's symptoms. It is lipophilic, so it can cross the blood-brain barrier, and it does bind to dopamine 1 and dopamine 2 receptors. So now Anaissa will take over and talk about dopamine agonists.
Thank you, Cody. So the next group of medications we're going to talk about is the dopamine agonists. Dopamine agonists mimic dopamine. They're able to go into the receptors, and it increases the overall levels of dopamine in the brain. Dopamine agonists do cross the blood-brain barrier, which is extremely important as they're able to fully encompass the dopamine behaviors. And it also lasts longer in the body than carbidopa and levodopa, which is interesting. So then here we have a compare and contrast with dopamine, which is on the left, and dopamine agonists, which are on the right. So dopamine itself is internal. We are able to produce this neurotransmitter naturally. And it can hit all the dopamine receptors, also as naturally as well. And the duration of action varies because of the way it interacts with the different receptors. Now, dopamine agonist, it does mimic dopamine without being converted, but it's not necessarily the way internal dopamine works. It's able to do its job and not be recognized as foreign, but it's also different in terms of its chemical structure, but it does function the same way as dopamine. The dopamine agonists primarily target D2 to D4, as opposed to all 5 of the receptors, and the half-life of these medications do vary between them. So the first medication in this group is Mirapex or pramipexole. This medication was introduced to the market in the late 1990s, in 1997, and this medication is meant to be taken by mouth, and it's able to be metabolized in the kidneys, and it's able to cross the blood-brain barrier as it's lipophilic, so it's able to be recognized as not foreign. And this Duration of action is meant to be 8 to 12 hours, so a good majority of the day. This class is meant to go to the D2 to D4 receptors. However, this medication specifically hits the D2 and D3 receptors. D2 is meant to work with the way we handle inhibition, the way we plan, and the way we have our working memory. And D3 receptors are meant to play a part in our cognitive and emotional function. And you can see on the right side, dopamine on the top and pramipexole on the bottom, they have a very similar chemical structure. But of course, there are different functional groups that make it a lot easier to enter the blood-brain barrier. Okay, and the next class in this group of medications is Requipt or ropinirole. Again, it was entered into the market around the same time as pramipexole in 1997. And this medication was also designed to be taken by mouth, except that this medication is metabolized in the liver as opposed to the kidneys. So this is really interesting, especially if somebody might have kidney issues or liver issues. So it plays a part in which medication would be recommended over something else when talking with your doctor. This duration of action is less than pramipexole. It is 6 hours. However, it is a substantial amount of time. And it also crosses the blood-brain barrier as well. And like its predecessor in this presentation, pramipexole, it also hits both D2 and D3 receptors. However, with studies out, it seems to favor D3 receptors, which is meant for more cognitive and emotional function. However, it still works to maintain motor function. And we're able to see on the right side dopamine and ropinirole chemical structures and its similarities. And like we said in the previous medication slide, the different additions of other elements are there to help it cross the blood-brain barrier to effectively do its job. And the last medication in this group we're going to be talking about is apomorphine. So apomorphine was actually studied decades ago, and it actually started to be more seen in medical journals in the 1970s. And this medication is taken by injections as it's different as its previous two medications we talked about. However, it is metabolized in the liver, which is worth noting. However, the duration of action is 60 minutes, so it is a lot less than the previous medications we were talking about. So this is more for acute episodes. But it also is lipophilic. It does cross the blood-brain barrier, and it's able to do its job as a mimicker of dopamine. It also works the same way as a medication that could cause nausea and vomiting. It hits a chemoreceptor trigger zone, is what we call it, but that's not necessarily to say that everybody will encounter this side effect. It's just something worth noting.
Hopefully you all now have a better understanding of the medications used to help control Parkinson's symptoms and the importance of the 5 dopamine receptors that we went over. I just wanted to thank y'all for y'all's time. And if y'all have any questions, please feel free to contact education@hapsonline.org. We also had a lot of people help us with this presentation, such as Dr. Maggie Abbott and our pharmacy director, Joy Alonzo. And our school has also helped us. So thank you again, and y'all have a wonderful day.
Thank you.